Okay, ma'am.
All right. So if you've read and understood considering your surgical pathology station, please tell me what are the differential diagnoses that you'll consider for this
Okay, I
patient?
have some differential diagnosis includes the undescended testis,
All right. And
testicular tumor, ectopic testis, retractile testis, or inguinal hernia, varicocele, or
very good,
inguinal
sir.
lymph
Very
node.
good. Very good. All right. Right. Tell me, how would you confirm your diagnosis?
Okay, ma'am. I'll confirm my diagnosis by taking history, examination, and doing some investigation.
Very good. For example?
Investigation includes at first I'll do the ultrasonogram of the inguinal region. Then I'll do the tumor marker, CT scan.
Yes. Okay. What would you expect to see on the ultrasound?
Okay, ultrasound tell me the size of the lesion and its consistency, echogenicity,
Yes,
and
very good.
involvement of the other structure, and if any regional lymph node involvement.
Right. What are the tumor markers that
Yes,
can be done?
yes, tumor marker. Yes, ma'am. Yes, I
Which
forgot.
one? Which ones?
Yes, tumor marker. I'll do the beta HCG, alpha fetoprotein, and LDAs.
For which
For
condition?
this patient, for testicular tumor.
Okay. Right. What are the different types of testicular tumor?
Okay, testicular tumor divided
Classified.
at firstly the classified firstly the germ cell tumor, seminomatous germ cell tumor includes the seminoma and spermatocytic tumor, and non-seminomatous germ cell tumor includes the embryonal cell carcinoma, yolk sac tumor, choriocarcinoma. Then testicular teratoma, sex cord tumor includes the leading cell and Sartori cell tumor.
All right. What about, can you tell me how would you define teratoma? What is teratoma?
Teratoma is the testicular tumor. It composed of all three germ layer and having the varying degree of differentiation.
All right. Good. What tumor markers can be tested in order to confirm teratoma?
Uh, for teratoma, actually there is no specific tumor
Mm-mm.
marker,
Okay.
but
No
we can do
Pacific,
the
but
alpha fetoprotein.
yes, alpha fetoprotein, and there is another CEA which can also be found in colorectal cancer and beta HCG. Right. Please tell me if there is one terminology which is called cryptorchidism. Please define it.
Sorry, ma'am.
Cryptorchidism, what do you understand by the term? Complete or partial failure of the
Oh, sorry, I can't hear, ma'am, your question.
crypto. Okay.
Okay,
Can
okay.
you define the term?
Yes,
Yes.
yes, yes, ma'am. I cannot hear first. Okay,
Okay.
is partial or complete failure of descent of the testis from abdomen to the scrotum,
Yes.
and it may lead to the testicular dysfunction or increase the risk of the testicular tumor.
What are the causes for this condition? Causes of this condition, etiology. Okay. So next question. Can you tell me the complications that can arise because of this condition?
Yes, in case of undescended testis, there may be the infertility, torsion of the testis. I associated the inguinal hernia.
And the most important, 40 times greater risk of carcinoma, the biggest complication. All right. What is the most common location for undescended testes?
Usually, it's lies in the inguinal canal most of the times. Sometimes
Yes,
in the deep ring or
external oblique.
intra-abdominal.
All right. Please tell me the differences between ectopic testes and undescended testes.
Okay, ma'am. ectopic testis lying apart from the normal pathway, and but undescended testis lying along the normal descent or pathway. Ectopic testis is fully normal testis, and undescended testis may be atrophied or some degeneration may occur there. And the scrotum is well developed in case of ectopic testis and underdeveloped in undescended testis.
Okay, good. All right. Please tell me, how should a patient with testicular tumor, susceptible testicular tumor, should be managed?
Okay, it's managed by the multidisciplinary team approach.
Very good.
By taking history, examination, and investigation, I'll confirm my diagnosis. Then I'll counseling the patient about the surgical option, and I'll do the orchidectomy by the inguinal approach and the
Yes.
specimen sent for the histopathology. After getting the report, I'll decide for the radiotherapy or chemotherapy with the help of multidisciplinary team approach.
What is the role of orchipexy?
Okay, ma'am. It can reduce the infertility and also reduce the chance of malignancy. And if any chance of malignancy, I can detect earlier and take the necessary steps.
All right. Please tell me. Okay. Now I have asked you most of the questions. Please tell me, what is the overall prognosis of testicular carcinoma?
Sorry, ma'am.
Overall prognosis of.
Okay, ma'am. Yes, I got. The prognosis in case of seminoma and good prognosis criteria, 5-year survival is 90 to 95%. In case of poor prognosis criteria, 5-year survival is 70%. In case of non-seminomatous germ cell tumor, good prognostic criteria, 5-year survival rate is 90%, and poor prognostic criteria, survival rate is 60%.
Okay, please discuss or tell me, what are the possible investigations that
Sorry,
can be
ma'am.
done? Yes, please tell me, what are the possible investigations that can be done to monitor the patient for possible recurrence?
Okay, ma'am. I'll do the tumor marker firstly,
Which ones?
and I can do the CT scan.
Which tumor markers? And how long
uh,
are you going to follow up the patient?
Okay, ma'am. A
Complete answer,
tumor
please.
marker, alpha fetoprotein, beta HCG, and LDS. Mainly LDS is very important.
Yes.
It's
If
tell me
yes.
the rate of the growth and the tumor burden, and the follow-up first 5 years every 6 months, then
Yes,
yearly lifelong.
until 10 years, first 10 years. All right, what are the time over, but last question. What are the most common sites of metastasis for a testicular tumor?
Most common sites is the para-aortic lymph node,
Yes, lymph nodes, liver and lungs.
liver, and lungs.
Right, good, thank you. Excellent.
Thank you, ma'am. Thank you, ma'am.